How does understanding nurse culture help nursing students prepare for their transition into practice? Hi, I'm Tenley. I'm a registered nurse, former clinical instructor, and author of New Nursing and the Art of Being Human. And today I'm partnering with Keith RN to talk about nurse culture and how discussing nurse culture earlier on in nursing students' school careers can help prepare them for that transition into practice in their nurse careers later down the line. So when I was a clinical instructor and I would take a new group of students to the hospital, I would always tell them the same thing, no matter what unit they were going to. And I would tell them, going to a new unit is like entering into a new culture, because each unit has their cultural customs, they speak their own language, they do things their certain way, and you really want to be respectful of that, much like you would be respectful of going to a new country and being immersed in the culture there. Now, I wish that I had understood that nursing was truly its own culture when I became a new nurse. I became a new nurse on the same floor that I had been a nurse's aide for 2 years prior to that transition. And yet I still went through kind of a cultural shock, even though I knew the culture of the unit to an extent, but I didn't understand what it meant to be a nurse on that unit until I was a nurse on that unit. And then again, like I said, I went through this cultural shock experience. And it turns out that I'm not the only one who went through that experience when they were a new nurse. In fact, nurse researchers Marlene Kramer and Dr. Judy Boychuk-Dutcher talk about cultural shock as being major components to the overall shock experience that new graduate nurses go through when they enter the profession. Because not only are you trying to navigate a professional role, like a career, and the job details that come with nursing, but you're also navigating what it means to be a nurse, what it means to be part of this new culture, what it means to be part of this community, and what the community even is, what the community is even doing, and kind of all of that on that side. Now, according to researcher Steen Walkerhausen, if I'm saying that name correctly, I hope that I am, there kind of are two perceptions to nursing. Now, the first perception is a macro understanding of what nursing is. And that macro understanding is kind of like the general public's idea of what nursing is. And then the micro understanding really only comes when a new nurse or nursing student really attunes themselves to nursing culture. And that's actually the best way that cultural shock in a new nurse can be resolved, is they're attuning to that culture, they're learning about that culture, they're learning a new way of thinking being in that culture, a new way of doing, and really getting attuned to that culture, like I said. So getting attuned to nursing culture is actually very important, not just for ourselves and our own wellness over here, but it's actually really important in our professional lives as well, because our understanding and participation in nurse culture can actually affect our patient care. For example, if you're a new nurse and you have a question, but you're too scared to ask your nursing community on the floor that you're on to ask it, then that's detrimental to the patient. So again, learning how to immerse yourself in that nurse culture and be a part of nurse culture and navigate that, being able to do that well will actually have better outcomes for your patients as well. So it's something that's super important for all of us, both ourselves and the people that we care for. Now, how exactly do we introduce nurse culture to nursing students throughout schooling? Well, I think that there's a couple ways that we can do this. And one great way, I think, is introducing nursing news to our students, saying, hey, this is what the community is really going through right now. This is what we're up against. These are our victories. These are things we're still fighting for, all of that. I just recently learned that nurses are fighting for nursing to be recognized as a STEM profession. I didn't know that we weren't a STEM profession. So there's a lot of really great advocacy work that is elevating our field that I think would benefit students to know about. Same with, what nurses are striking right now, what are they striking for, really shows nursing students, okay, this is kind of the state that we're in. This is the amazing ways that we're fighting, but the battle isn't over. So just be prepared that there's some of that going on right now in healthcare. I think another thing that we can do is allow for reflective spaces for our nursing students. So, if they're having to do reflection journals after clinicals, for example, not just reflecting on what kind of patients you had today, but, what kind of nurse did you have today? How did they navigate teamwork? Were they supported? Were they stressed? What did your nurse go through today? And what was their experience? And then also allowing for a space for nursing students to debrief the hard things that they've seen, the good things, and to ask questions like, hey, this part about being a nurse sounds kind of daunting. For example, making mistakes. How do you navigate making mistakes as a nurse? I feel like sometimes we can be a little bit hush-hush about certain things. So I think just allowing for a space for nursing students to debrief both what they've seen and ask vulnerable questions that they have, I think would be really beneficial. And those three ways are ways in which we can really start to introduce our nurse culture to our students so that they won't be totally, completely blindsided by a cultural shock phenomenon when they transition into practice themselves. I hope that this helps. Thank you so much. It's been great talking to you.